Hello, my name is Sean Simmons. I'm a physical therapist at Specialized Physical Therapy of the Carolinas in Asheville, North Carolina. And today I'd like to share a presentation with you called Healthy Bones that was created by the California Physical Therapy Association in 2006. Briefly, I'd like to go over the role of a physical therapist in healthcare. Physical therapists are university-educated health professionals. At this time, it is required that all physical therapists graduating have a doctorate in physical therapy. We are experts in examination and treatment of problems that affect people's ability to move and function. We are also known as the movement specialists in the healthcare field. While many of you have worked with a physical therapist post-injury or surgery, physical therapists also have a strong role in the prevention of injuries and overall wellness. We can provide expert help to improve your ability to participate in all sorts of activities through a physical fitness regimen. Our primary strengths are diagnosing movement-related health conditions that decrease your ability to move throughout the day. Our goal through treatment is to restore and maximize your physical function. In that role of prevention and wellness, we are able to develop personal fitness and wellness programs that include a healthy and active lifestyle. We are also trained to gear these programs to reduce the risk of conditions that are associated with the loss of mobility or function. At the end of the day, we help you move. And finally, as in many states in the country now, North Carolina is considered a direct access state, which means that you do not need a referral from the doctor and you do not need a doctor's visit before coming to physical therapy anymore. And the insurance will still cover it. So if you have an ache, pain, or other condition, you can come directly in to see a physical therapist. The New England Journal of Medicine defined osteoporosis as a loss of bone mass and microarchitectural deterioration of the skeleton leading to increased risk of fracture. Bone loss is usually painless and often unnoticed until a fracture or height loss occurs. A height loss of greater than 2 inches from a height at age 25 may reflect underlying vertebral fractures. Height loss is often associated with a stooped posture and a rounding of the spine. This is also known as kyphosis, which is an increased curvature in the upper back and may be caused by weakness in the postural support muscles or deformity of the bones in your spine. Kyphosis also may be an indication of underlying vertebral compression fractures and cause an increase in stooped posture. However, an increased curvature in the upper back is also a risk factor for future fractures, regardless of low bone mass prior to the fracture. Those of us with osteoporosis are not alone by any stretch of the imagination. There are 10 million Americans that have osteoporosis, and that number is expected to grow as the elderly population grows. Another 24 million have low bone mass, also known as osteopenia. These people are at risk for becoming osteoporotic. So of the 10 million Americans over the age of 50 with osteoporosis, 80% are women. Osteoporosis affects women more than men, and this is because women start out with less bone mass and lose at a faster rate than men. However, men are the fastest growing group being diagnosed with osteoporosis, again, as the elderly population grows. Osteoporosis affects people of all races and cultures, although those of Northern European and Asian descent are at a greater risk. This is an interesting graphic from the 2004 Surgeon General's report on bone health and osteoporosis. And this is just showing us that the amount of osteoporosis is expected to grow pretty substantially in the next few years. The number of people with osteoporosis and low bone mass is growing. At 52.4 million in 2010 to an estimated 61.4 million by 2020. By 2020, 1 in 2 Americans over the age of 50 is expected to have or be at risk of having osteoporosis of the hip. A great number of Americans will be at risk for developing osteoporosis at any site in the skeleton. 1 in every 2 women and 1 in every 8 men will have an osteoporosis-related fracture sometime in their life. This chart is showing the importance of preventing osteoporosis and doing what you can to prevent it. Osteoporosis is the most common cause of fractures, and osteoporosis is costly, and not only in dollars. Osteoporosis fractures can be painful and may result in decreased independence in walking, daily activity, and self-care, and a reduced quality of life. Half of those who fracture a hip never regain their prior level of function and have an increased risk of mortality after hip fractures. 24% die within a year after the hip fracture. This just shows you how important preventing these things are. These are not minor injuries that you just bounce back from. This has serious implications to your health and your life. So, looking at the chart, the far left here shows fractures from osteoporosis, which is around 1.5 million. These are all from the 2004 report from the Surgeon General. Over 500,000 hospitalizations, over 800,000 trips to the emergency room, and over 2.6 million visits to the doctor's office. And then finally, on the far right there, it looks like a small number, but it's really an enormous number. People placed in nursing homes is approximately 180,000 people each year, which is just a huge number and just an enormous impact on your life and quality of life. So hopefully one of the questions you're asking yourself at this point is, are you at risk? There are many risk factors for osteoporosis, and many are genetically determined and uncontrollable. For instance, we cannot control your age, gender, race, and menopausal status. Women and men are at risk for osteoporosis, but women are more susceptible because they start with lower bone mass and lose it at a faster rate. There's an accelerated loss of bone 5 to 10 years after menopause. Women are especially prone to vertebral fractures because they lose so much trabecular bone after menopause. Vertebral bodies are comprised primarily of this type of bone, a relatively spongy and porous type. Cortical bone is denser and makes up the shaft of the long bones. The loss of cortical bone, as in the hip, is more gradual and consistent throughout aging. Medications such as corticosteroids, anticonvulsants, chemotherapy agents, immunosuppressants, and heparin may increase your risk for osteoporosis. People with medical conditions such as rheumatoid arthritis, lymphoma, COPD, AIDS, anorexia, and hyperparathyroidism are all at a greater risk for osteoporosis. The good news is there are many risk factors for osteoporosis that we can control. Although 75% of the determinants for osteoporosis are genetically based, there is a lot we can do to maximize our bone mass and prevent the bone loss that occurs with aging. Calcium is needed for proper function of the heart, nerves, muscles, and blood. Inadequate dietary calcium contributes to osteoporosis. Depending on your age, appropriate intake falls between 1,000 and 1,500 milligrams a day. The National Academy of Sciences and National Osteoporosis Foundation recommend that women over the age of 50 consume at least 1,200 milligrams of elemental calcium. The safe upper limit is set at about 2,500 milligrams a day. Nutrition studies show that most women and young girls consume only half of what they need. A supplement can provide what cannot be obtained from foods when needed. Vitamin D also is needed for the body to absorb calcium. Between 400 and 800 milligrams is recommended, unless a deficiency is found on blood testing, and then the dose can be higher. It's something to consult your physician about. Avoiding weight loss. Even voluntary weight loss has been associated with bone loss. Unless you and your physician feel you are overweight, it is best to maintain your current body weight. Also avoiding the use of tobacco, excessive alcohol, as these may damage your bone-building cells.